It's time for Baby and Toddler Instructions with host Blythe Lipman. Blythe is a nationally renowned infant and toddler expert who has over 30 years' experience helping moms and dads regain their sanity, teaching them how to survive, and giving them the confidence they need to be the best parents ever. From sleeping to crying to potty training to choosing a preschool and so much more. If you're a parent, Baby and Toddler Instructions is the show you've been looking for. Now here's your host, Blythe Lipman.
Well, good morning, afternoon, evening, wherever in the world you might be. How is everyone this morning? Thanks so much for tuning in to Baby and Toddler Instructions. I have to tell you, I need an extra cup of coffee this morning because, as we all know, it was daylight savings started, and Arizona does not change, so it's only 8 o'clock here. But the show is always 11 o'clock Eastern, so if you tune in every week, which I hope you do, that time never changes. However, if you have a little one, your little one may be a little messed up for a couple of days, try putting them to bed, a little earlier, 10 minutes earlier every night if you can. I know you cannot make a baby or a toddler sleep if they're not tired. But anyway, it all works out eventually. Also, I want to wish everybody some good weather and warm sunshine. My gosh, the country got socked, part of the country. Everybody stay safe. If they say stay off the roads, don't go out. I mean, there's a reason for that. Anyway, what else do I have to say today? Well, we have an exciting guest who'll be with us in just a bit. Her name is Dr. Catherine Sledge. She is a pediatric dentist, and we're going to talk all about dental health. But a little bit of trivia here. Yesterday was a National Pie Day, which made me laugh because it's P-I, not P-I-E, P-I. It says the day honors the irrational number pi, or 3 or 14, and has come to be known as a day in which restaurants promote pies. And you know what? It's pretty funny because pi is the ratio of a circle's circumference to its diameter, which I didn't know, but the mathematical symbol is more than a sign for saving. So everybody, I hope you had some good pie, and it's perfect because Dr. Sledge is going to talk to us in just a bit about if your little one ate pie and how to have good dental health. But there were a couple recalls this week. The Lively, L-I-V-L-Y company recalled children's robes and two-piece pajama sets. It says they failed to meet the flammability standard, posing a risk of burn injuries to children, God forbid, if there's a fire. I say this all the time when I see this kind of recall. I had hoped that they'd be finished with this. They've recalled so many things with this flammability deal. Use something that's not flammable. Pretty scary. Also, there was another company, RDG Global, recalled girls' hooded sweatshirts. Here's another one. It says there's a drawstring in the hood which poses a strangulation hazard. Drawstrings can become entangled or caught on playground slides, handrails, school bus doors, or other moving objects. And that, of course, is a hazard. But don't most hooded sweatshirts have ties or drawstrings? You just have to be careful and make sure if you're going to put something on your little one that does have a string, watch them. Make sure they're old enough to not take that string and start eating it or wrapping it around their neck, God forbid. Anyway, the recalls are on my website, mybestparentingadvice.com, and they're up to date. And please, please, if you have anything that's been recalled, do not fix it yourself. Call the company. There's 800 numbers for all of them. There's website, contact numbers, emails. So want to keep those little ones safe. And speaking of recalls, I don't know if you heard this, but there was an interesting story on the news this week about baby toys and baby gear. It says, is baby gear getting more dangerous? Data reveals sharp increase in a rate of injuries with one accident every 8 minutes. A new analysis published in Pediatrics reveals more than 66,000 injuries a year, which is an increase of 24% since 2003. And what they're talking about, it says injuries are on the rise, and roughly 4 in 5 are due to falls, researchers report in Pediatrics. What's surprising is how many children are still experiencing nursery-related, product-related injuries, serious enough to go to the emergency room. 1 every 8 minutes. Boy, that's a lot. But the other thing is, it says concussions and other head injuries appear to be driving this surge because, there have been so much press on concussions, which they never brought out before. Kids will fall down all the time. We know that, especially when they first start walking and they have those little legs spread. I'm sitting here doing this. It's a good thing you can't see me. And they're very unstable, and they fall, and, they fall. Sometimes they could hit their head. And just the fact that they've brought out all this information about concussions, I guess parents are checking it out quicker, which is a great idea. But the other thing they said that was so surprising to me is that the most common culprit of these injuries were baby carriers. They counted for 20% of the accidents. Also, it said the injuries happen when parents don't use buckles or safety straps properly, or infants are placed on high surfaces like a table or a counter instead of the floor, and also bedding in the cribs, stuffed animals, all that. The strollers were 17% of the injuries. Anyway, the thing that did get better is because the walkers got safer and they don't have wheels on them for the most part, and babies can't walk or, God forbid, fall down the steps. That's better because these activity centers like exercisers are stationary, so it gave parents a safer alternative. I'm not going to read you the whole study, but you know how I like to share studies that are important about keeping our little ones safe. The one thing that's wrong with the study is that they only checked out the emergency room injuries. It's not that there's something wrong with it. It's just that who knows if it's accurate. The bottom line is, as we always say, keep your little ones safe. If anything you buy them comes with buckles or straps, make sure you use them. If you put your baby on the changing table and you forgot something, pick your baby up, because I guarantee you they'll roll off. Takes 2 seconds. You know what? Many babies roll off at changing tables, beds. Most of the time they do not get hurt because they're relaxed. Unlike us, who we brace ourselves if we're going to fall. Babies are pretty relaxed, so they usually do not get hurt. But keep your little ones safe. Use everything. Use the straps. Use the buckles. So that I thought was interesting. Also, since we're going to be talking to Dr. Catherine Sledge, pediatric dentist, I wanted to share a couple things from my book, Help! My Toddler Came Without Instructions, my chapter called Cooks and Books. Because why? It's about food, and we have to brush our teeth and our little ones' teeth. Anyway, my chapter I wrote because it's so much fun to cook with your little ones, and then share a book with them. When they're old enough, to start helping you, even just holding a spoon and mixing it, you can do an activity with them with food for lunch and then read the book. One of my favorite ones, which, even a 9-month-old can do with you, is to make bagel faces. Get a bagel, cut it in half, and let your little one spread some cream cheese with a plastic knife, a spoon, or even they can use their fingers. And then decorate the bagel. Put olives for eyes, put cucumbers for eyes, you can put carrots for the nose, pepper strips for the smile, and then eat it. Sit down, eat it, have fun, talk about the food. Everything's a teaching moment. And then there's a great book called All About Faces by Lazoo, and you can read that book. Also, let me share another quick one that's really easy for your little one and you to have so much fun. Make some pretend soup. All you need to do is take some orange juice, plain yogurt, if they're old enough, a little bit of honey, a small banana, some blueberries, strawberries, raspberries, whatever your little one likes. Put them in the measuring cup. Let them mix up the yogurt and the orange juice, and float some of the banana slices on top. And then you can eat the pretend soup and read this great book called Dragon's Alphabet Soup by Rachel Yu and Michael Yu. And that's really fun to do. Last but not least, make some circus pudding. Make some instant pudding, and I've done this in my toddler classes many times. Let them help you mix and make instant pudding. It's just 2 cups of milk and a box of instant pudding, whatever you like, and let them mix like the package said, and you have them ladle it into a paper cup and decorate the top with circus animal cookies. You can crush up graham crackers, any kind of decoration, which is really fun. And then there are 2 books which are really fun to read with them. Thomas Goes to the Circus and Diary of a Worm. Those are just a few of my recipes that are easy and fun to do with your little ones for a cooking activity. And then we can talk about, after we eat those wonderful things, do we brush the teeth? When do we start? Do we wipe the gums? So let me tell you a little bit about my guest, and then we're going to have a break, and I will introduce you to her when we come back. Dr. Catherine Sledge graduated from the University of Mississippi Medical Center School of Dentistry. She owns Carter Sledge Family Dentistry with her father, Dr. Michael Carter. Together, they've made it one of the best dental practices in the region. She's passionate about child and infant oral health. She's one of the top experts in her area on tethered oral issues called TOTS and tongue tie. And I have to ask her how to say this because I'm not sure if I say it right. I think I'm going to wait. Tongue tie, we'll wait. Anyway, tongue tie is fairly common, but a serious oral health condition that oftentimes shows up when infants struggle with breastfeeding, and we're going to talk about tongue tie. Also, she's had a long-time involvement in fighting childhood obesity in Mississippi, heading projects such as You've Got to Move, and educating others about this. That's another way to improve public health in her beloved state of Mississippi, and she is a member of the American Dental Association, Mississippi Dental Association, Mississippi Association of Women Dentists, and the International Affiliation of Tongue Tie Professionals called IATP. Let's see, Ankyloglossia. I don't know if I'm saying that right, but I am going to have her tell us how to say this word, which means tongue tie. And, if you don't know what it is, you will learn. Not all children get it. We will learn everything about that. We will learn about when we should start wiping our little ones' gums, brushing their teeth. We can talk about tooth injuries. If you have a question, comment, or want to call us during the show, the number is 877-864-4869. Call us, ask your questions, or just say good morning. I love callers. Stay with us. We'll be right back.
We'll be right back with more Help My Baby Came Without Instructions. It's Baby and Toddler Instructions with Blythe Lipman on TogiNet. We'll be right back right after these. LinkedIn. It's a great tool and a great way to do business in today's social media driven world. And Carol McManus is the LinkedIn Lady with the LinkedIn Lady Show. Tuesday and Wednesday afternoons at 4 p.m. Eastern on allbusinessradionetwork.com. The LinkedIn Lady Show is designed to inform, inspire, and educate businesses. Every social media site has a specific demographic, personality, and purpose. And the LinkedIn Lady will interview a variety of guests, such as business owners who can showcase their business and talk about how they use social media, such as Facebook, Twitter, YouTube, Google+, Pinterest, and of course, LinkedIn. For more on Carol and the show, check out her website, LinkedInLady.com. As trends change and new applications become available, the LinkedIn Lady Show will bring that information to you in an easy-to-use, fun, and engaging way. Every Tuesday and Wednesday afternoons at 4 p.m. Eastern, it's the LinkedIn Lady Show with Carol McManus on allbusinessradionetwork.com.
This is the TogiNet Radio Network, radio with a cutting edge.
years ago, some fishermen off the coast of Italy discovered some pottery along with fish in their nets. Divers were called out and discovered an ancient Roman ship whose galley, or caboose, a nautical term for kitchen, was extremely intact. Some of the food uncovered on board was pickled fish, wine, oil, and grain used to make the ship's biscuits, otherwise known as dandy funks. It is thought the 2,000-year-old boat was probably on its way to Spain when it sunk and was covered by layers of mud, baggy wrinkles and all. Baggy wrinkles are another name for the ship's ropes. The mud protected the ship from wear, explaining why the leftover food on board was still in such good condition. We land lubbers may not be familiar with leftovers on the sea, but we are familiar with leftovers in our kitchen.
It's words you never heard.
I'm Carolyn Davidson, and you can have fun challenging your words you never heard vocabulary with my free app, Too Funny for Words.
Welcome back to Baby and Toddler Instructions with Blythe Lipman on TogiNet, the hour for all moms with little ones to come for great advice, encouragement, and great ideas for all new parents. Now, back to the show with Blythe Lipman.
Well, welcome back to Baby and Toddler Instructions. Thanks for tuning in. Today's show is live. It is March 15th, 2017, and you can always listen to any of the podcasts 24/7, Moby-friendly, on everything. You can go to toginet.com and always my website, mybestparentingadvice.com. And again, the toll-free number here is 877-864-4869. And I want to welcome Dr. Catherine Sledge to the program today, and I do need to make a correction. She is not a pediatric dentist. However, she takes care of lots of little ones. So that was my mistake, but as long as she takes care of our little ones' dental health, that's what counts. So ankyloglossia, did I get it?
You're so close. It's ankyloglossia.
Ankyloglossia. What is it? And before we get into that, if you're listening, you will find out everything you need to know about it, because I do know about it, because that was something we thought maybe my grandson had when he was born. But anyway, before we get into that, Dr. Sledge, welcome to the show. Did you always want to be a dentist? You're in with your dad, and that's great.
Yes. Thank you, and good morning, and I'm very glad to be here. I always knew I wanted to go into the medical field, and I thought I would just be a physician. And as I got into college and started shadowing all different types of physicians, there wasn't anything that just really struck my fancy that I loved or thought I'd be passionate about. And, of course, I had watched my father be a dentist my whole life and love his job and also have a great family life. And so I worked for an oral surgeon the summer after my first year of college, and I thought, wow, it was like a light bulb went off. And I thought, I really like this area of the body. This is so interesting. It's there's a lot of cool things about it, and you can really help people. And then it's like Dad was like, well, okay, I've been trying to tell you this, So anyway, that's when I decided to apply to dental school instead of med school, and it's been a wonderful choice. I love what I do, and I especially love taking care of children. And as you mentioned, I'm not a pediatric specialist, but I see lots of children, and a lot of people often mistake me for a pediatric only dentist because I do treat ankyloglossia, which is an issue that a lot of pediatric dentists don't treat very often. It's kind of it's a newer. It's not a new problem, but the solutions to it are becoming more apparent, and so there aren't a lot of providers out there who are treating it yet.
Well, let's get right into it and tell my listeners what it is, because reading some of the things about how they treat it. When my grandson was born, they thought he had that, and I didn't hear the word. I only heard tongue tie. And, in all the years that I've been taking care of children, I knew a little bit about it, but not a lot. So tell my listeners what it is, how you can fix it. Are they supposed to be getting really nervous?
Okay. Tongue tie, which and I call it that all the time. Obviously, ankyloglossia is just the medical term for it, but it is a condition in which an infant or child has a congenital abnormality where the piece of tissue that connects the tongue to the floor of the mouth is too tight, and that can have a lot of issues that come along with that. Where it usually first shows up is if a mother is trying to breastfeed. The child is not able to transfer milk well. The mother will have a lot of issues herself with pain, difficulty breastfeeding. The child may not be gaining weight as quickly as they should, and have difficulty, fall asleep much more often on the breast, those types of things. And when the mama goes in for the 2-week checkup or the 1-week checkup, and the nurse or doctor says, well, he's not gaining quite as well as we'd like, that may be one indicator. Of course, that's not the only problem that can cause that issue, but that's where it often shows up first. Later on down the road, what tongue tie can cause is difficulties in speech, developmentally, can even cause, even further down the road, crowding, orthodontic issues as far as teeth go that could have been avoided if the tongue tie had been taken care of at an early age. So lots of different issues that it can cause. Treatment is very simple and easy. There are two main modes of treating the tongue tie. One is just using scissors, and one is using a laser. And that's what I use because I believe it's the best that there is. There's very little post-op pain, almost no risk of infection afterwards. It's easy on the child, and they can get right back to mama and nurse or take their bottle right after a procedure. And it's really pretty simple.
I just received a question. Is there any indication of tongue tie? The question says, is there any indication of tongue tie if your child takes a bottle but doesn't take the bottle great?
Possibly. It may be something that you need to at least consider as a differential diagnosis of, okay, this may be part of the issue. It would be worth getting the child evaluated for sure. There could be other issues involved there as well, but it would be worth an evaluation.
Also, another question, lots of questions today. That's great. Another question, you don't cut the tongue. Can you explain what you cut? I think my listeners are thinking you go in and cut their tongue or something.
No, okay. So for any of you listening, grab a mirror or something that you can look at your own tongue, and if you lift the tip of your tongue up towards the roof of your mouth, you will see, in most people, it's a skinny band of tissue, and that is the frenum. And I'm sorry, I should have used this word earlier when I talked about the band of tissue. It's called the frenum, or some people call it a frenulum, same thing. And that little band of tissue is what is cut or at least partially removed with the laser. In a normal development, that piece of tissue is there, and it's important, but it does not restrict the tongue in any way. In tongue tie, that piece of tissue, when a baby develops embryologically, instead of it kind of coming all the way up as it's supposed to and completely sort of separating out and allowing the tongue to move freely, it's not as long and as pliable as it should be, and it causes the tongue to be restricted in movement, and that is what causes all the issues.
Okay.
Did that answer the question?
What do you do? How do you fix it?
So that little band of tissue is what is clipped if you use scissors, or with a laser, what is just very kind of carefully removed, or at least part of that tissue. I remove it to a point to where the tongue is able to move freely, unrestricted.
And as the child grows, can it get tight again? Can it get too tight, or once it's fixed, is it fixed?
So that is the goal. There are important aftercare regimens that you've got to do as a parent after the procedure is done to ensure that the tongue does not reattach. Because as you can imagine, a large portion of the time, the tongue is just sitting there in the floor of the mouth, and so that tissue would just heal right back close together, just like it was if the exercises are not done. So those involve anywhere from 3 to 5 times a day in the first couple of weeks after the procedure's done. Taking, I usually recommend that my patients take a little topical agent like Oragel Naturals or something like that, and they, on a clean finger, put a little bit of that, and they actually have to sort of stretch that area back over where the surgery was done. And you do it gently so it's not painful to the child. They don't like it, and it's probably sore, but it's not. You're not hurting them, but it's got to be done in order to think of it as almost like physical therapy after you've broken a leg or something like that. You've got to get in there and ensure that tissue is not going to heal right back so that the problems will continue.
Okay, now we got another good question. Talk about getting graphic here. This mom wants to know, does it bleed a lot? Because mouths tend to bleed.
Right. Very good question. That is one of the reasons why I choose to use a laser, because a laser cauterizes the tissue as it cuts. And so there's not a lot of bleeding, which is much easier on the infant because there's not all of that excess moisture in there, and it tastes bad. And thankfully, the mouth does bleed a lot, but it also heals really well and really quickly. It's one of the fastest healing areas in the body. But I would much rather have that be easier on infant and on mama too, because when mama sees blood, that's doesn't make us happy. I'm a mama too, so it can be upsetting, and so that the laser will just cauterize that tissue immediately, so you don't have that problem.
This is such great explanation for all this, because I know, many parents are told this at birth. So the other question is, can you see it? Like when you have a newborn baby, can you see it when you look at the tongue? Because I'm just saying from my own experience, I remember with my grandson, they told us that he possibly had it. And we keep looking at the tongue and we didn't know what we're looking at, obviously. Their baby's tongue is so tiny when they're 6 pounds.
Right.
Is that something you can see before they start breastfeeding, or is that the number one sign that you would look at?
Sometimes is the answer. I know that's not super helpful, but on a very very obvious tongue tie where the tie comes very anterior to the tongue, when the child picks the tongue up, you'll see kind of a cupping. It'll look like the center of the tongue sort of comes down in like a C shape. And also what can happen if in a very restricted tongue, as the child's tongue comes forward, you'll see a little dent in the tip of the tongue, like it almost looks like a heart shape. But those are not as common. I mean, that's a very significant tongue tie that any neonatologist or lactation consultant would hopefully be able to see right away in the hospital. But there are other classifications of the tongue tie that are more posterior. Sometimes it's submucosal, the tie is. So basically what that means is the thick tissue that really needs to be cut is sort of under the edge of the mucosa or the tissue in the mouth. And for that, you'd need to have a full evaluation by a provider who treats this, which not all dentists and not all pediatric dentists do. There are some who do out there. You kind of have to look and check into that. And there's some ENTs who do it as well. The only issue with that is most physicians who treat this advocate that children need to be put under general anesthesia to be able to have the procedure done, and that is not the case. It can be much simpler. I do it in office in just my normal dental chair, and the baby's back to mama with no anesthesia. I mean, the whole procedure takes 1 minute.
Well, great explanation. We are going to break for commercial, and when we come back, I'll be talking more to Dr. Catherine Sledge about dental health for your little ones. Stay with us.
We'll be right back with more help. For help, my baby came without instructions. It's Baby and Toddler Instructions with Blythe Lipman on TogiNet. We'll be right back right after these.
Baby love, my baby love, I need you, oh, I need you.
It's words you never heard.
Recently, while my family was skiing in Colorado, we were greeted by a red fox that darted out of the trees. This beautiful animal with his big bushy tail just stood in the snow and stared right at us. Maybe he smelled all the liverwort we had in our pockets. Liverwort is another word for junk and snack food. Typically, a red fox eats scrub and woodland, but this one appeared to have had his share of hamburgers and hot dogs from the Chalet Grill. Foxes are similar to dogs, except they are not pack animals. The female fox, or vixen, typically gives birth to a litter of 2 to 12 pups. When they are young, they all live together as a family, known as a leash of foxes. Once grown, the young foxes leave the burrow and go out to live on their own.
It's words you never heard.
I'm Carolyn Davidson, and you can have fun challenging your words you never heard vocabulary with my free app, Too Funny for Words.
It's words you never heard.
One of my favorite books is called Forgotten English by author Jeffrey Kaser, who looks at the origins and histories of the language. For example, take the term Fritterwohn. That's an old English expression, probably borrowed from German, that means fleeting weeks and refers to what we call a honeymoon. A fribbler is a guy who doesn't ever make it to the honeymoon. The word fribbler comes from the 18th century and refers to a man who is in love with a woman but just won't commit to marriage. Chaucer coined the term pigasnia, which comes from the phrase pig's eye to mean sweetheart. Hey guys, why don't you try that one on your girlfriend and see how it goes?
It's words you never heard.
I'm Carolyn Davidson, and you can have fun challenging your words you never heard vocabulary with my free app, Too Funny for Words.
Welcome back to Baby and Toddler Instructions with Blythe Lipman on TogiNet, the hour for all moms with little ones to come for great advice, encouragement, and great ideas for all new parents. Now, back to the show with Blythe Lipman.
Well, welcome back to Baby and Toddler Instructions. Thanks for tuning in. I'm here with my wonderful guest, Dr. Catherine Sledge. We were talking about tongue tie before the break, but I have some other questions. That was such great explanation, and Dr. Catherine, you're so calming because, if there's a parent that's listening and they possibly think their child has tongue tie, they can breathe easier because you explained everything, excuse me, so wonderfully that it's not, I wouldn't be in a panic. Now that we understand it all. So let's talk a little bit more about dental health. When should you take your little one to the dentist? What age?
The American Association of Pediatric Dentists recommends really when they get their first teeth. So a good rule of thumb is by the first birthday, you need to have your first dental visit. Most children will get their first teeth around the age of 6 months, sometimes a little bit later, really between 6 and 12. So we want to go ahead and get you in, check and make sure baby's looking good developmentally. Also go ahead and get them kind of used to coming to the dentist. At my office, we call it a happy visit. Their first visit is a happy visit.
Great.
And
it should
also
be.
It's a good time to educate parents and make sure that mom and dad know all of the things to be doing and not doing as those baby teeth are coming in.
So before we talk about what they should be doing when they're coming in, when do you start wiping the gums? We always hear you should take a gauze cloth and you should wipe the gums after they breastfeed. Is that still true?
Yes, absolutely. So even infants, it will benefit from just taking just a wet washcloth or whatever you have and just kind of gently stimulating those gums because it increases blood flow and also would remove any debris. Now, especially once your baby starts eating solids, and of course there's a big debate on when that starts, but that's even more important with a baby who's moved on to solid food, even if it is a mixture of solid food and breast milk or solid food and formula.
Okay, so do you have a tip? Because we have another question. When my child brushes her teeth, she doesn't brush her teeth. She's only 2, and it looks like this mom's trying to get her used to the toothbrush. Like all children, she just sucks on it. And they put a little toothpaste, and she just sucks on it, and I can't show her how to brush her teeth. I mean, obviously at 2, a child can't brush their own teeth.
Right.
But what are your tips?
So the best thing to do, one thing that helps is if you can brush your teeth at the same time, you can show your child, if a child, for example, is being behaviorally difficult with wanting to do it, you can say, look at mama or look at daddy, this is what I'm doing. And then you still need to brush their teeth, of course, to get it done adequately. And so make sure you do it first, and then the child, after you've brushed their teeth, can kind of do it themselves and imitate you. They just don't have the dexterity in their little hands and fingers to be able to brush effectively until a good bit later in childhood. I mean, probably really by between age 6 or 8 is when a child can be expected to brush, be able to brush well by themselves. Another thing for real little ones, one of mine was easy and is super obedient pretty much all the time. I guess that's the first child thing. And then the second one is a little more defiant about things. So, I mean, for me personally, and I tell other moms this too, a lot of times if a child is having a difficult time letting you brush their teeth, if you can lay them back onto, your bathroom counter or wherever you are brushing their teeth, on a towel, some type of soft surface, and then you can brush their teeth that way. Hold their little hands in your other hand, and then brush, because that way it kind of puts them into a posture of a little bit more, okay, I'm not the one in charge here. Because if they're standing up and they're tossing their head around and not wanting to let you do it, then that's more difficult. But if you lay them back, that can be helpful.
That's a great tip. I have another tip to share that I've used with parents too. If your child's old enough, before you brush their teeth, let them brush your teeth with your toothbrush. Let them take it so they can see what they're doing. And let them brush your teeth, and then you say, Mommy's going to brush your teeth. And if they're cooperative, all children are different. Sometimes that tip works too. What do you think about toothpaste? Because, some of the toothpaste, they have all the pictures and they're happy. And I think sometimes the toothpaste tastes so good that the brushing doesn't happen because they're sucking on the toothbrush.
Right, exactly. And that's why I said, Mama or Daddy, you brush their teeth first before they take the toothbrushing practice themselves. Because if you put the toothpaste on there and you let them do it first, all that toothpaste is going to be gone straight down the gullet. And, we'd prefer that they not do that and actually use the toothpaste to brush their teeth so that all of the teeth get covered with the fluoride that's in the toothpaste. And on that note, I'm sorry, go ahead.
I was going to say, so they do need toothpaste on their brush, not just water.
Once they reach age 2 is when we start recommending that they use a fluoridated toothpaste, because that's going to strengthen the teeth. Before age 2, you can use water, or you can use non-fluoridated toothpaste, which most drugstores and grocery stores sell. And you don't need, the amount is like pea-sized, and I'm talking about a small pea. Really under age 2, you just need kind of a little smear of toothpaste.
Okay, I was going to ask you something else about the tooth. Okay, so the toothpaste is a yes once they're doing age 2. What are you doing with fluoride lately? Are you still giving kids fluoride? That was a big thing years ago. Is that still happening?
Yes, absolutely. It's very important. It's one of the easiest public health initiatives that really has been made in our country that has really improved children's health and as they grow into adults in a real way. So most water systems are fluoridated. If you live in a very rural area and maybe you were drinking well water or something like that, you want to talk to your dentist about having some type of fluoride supplement, because it's important for kids, for the strength of their teeth long term, to have that regular fluoride. As far as toothpaste goes, and the reason why we don't recommend the fluoridated toothpaste until age 2 is obviously little ones are more susceptible and to any type of overdose, which the chances of that happening is very low. You wouldn't want them to eat an entire tube of toothpaste, but that's why, just better safe than sorry, we recommend no fluoride until age 2. We do put topical fluoride on all children, including infants, every 6 months. That is what the research has shown is most effective to developing strong, healthy teeth. So when a child comes in at the end of their exam, and we're really excited around here because we just got new flavor. We've got cupcake flavored and sugar cookie flavor fluoride. So we're able to just paint that on a child's teeth to help strengthen that enamel and make sure they have strong, healthy teeth for the years ahead.
Boy, that will get them, too, to open their mouth, to say ah, and to let them do it. Do you have any tricks for that? When you have a little one in the chair and they will not open their mouth?
Well, we sing. Showing Mama on Mama again is a good way. That's kind of my best trick. But worst case scenario, sometimes with little ones, they're a little bit scared by the experience, and so they cry. That's how they communicate. Real little ones, and that's okay. And most of those ones who are even a little bit upset, once everything is done, I say, okay, can you give me a hug? I need a big hug. And they, have a big smile on their face and give me a hug. So it's not, obviously it's not a painful experience. It can just be a little bit scary, but I usually tell Mom or Dad that it's okay if they cry. I can see their teeth better that way. So.
That's true. Mm-hmm. That's really true. What about, okay, another question is, we have the happy visit for the little ones. What about the happy visit for the moms that are scared to death of going to the dentist?
I know, exactly. We try to make those happy visits too. We obviously, as I said, I'm a general dentist, so I treat all ages from 0 down to up to 99. So we try to. One thing that is very important to me is calming anxiety in my patients. Most people, I would say more people than not, have anxiety about coming to the dentist for a variety of reasons. And I love to be able to make, whether it's a child and a mama or the mama by herself, or anyone, be able to feel comfortable with being here.
Well, can you just fly out to Arizona when I need my cleaning?
You know what? I'm actually coming to Arizona in a few months for a new laser that we're going to be getting for some training. So I'll just stop by.
Well, you stop by, bring all your tools. Actually, I really love my dentist. She's a woman, and I'm one of those people that I am scared to go to the dentist, and it has to do with something that happened to me in childhood. And I go because of course I want to keep my teeth and clean them and have good dental health, but it's interesting because you have these poor moms that are scared, and kids pick up on it. And you're great. I'm sure you calm everybody down when they come into your office.
But that is, okay, what you just said is such a good point. For moms and dads listening out there, the very best thing you can do for your child is for your attitude yourself to be, this is going to be so much fun. We're going to meet Dr. such and such, and you may even get a treat at the end. Most dentists have a little toy box or treasure chest. That's what we have for our kids when they're done. But mom or dad's attitude makes a big impact on a child. And as far as when I have to do procedures on children, where they need to be anesthetized, the worst thing is if mom or dad has said all along, okay, you better brush your teeth or you're going to have to go to the dentist and get a shot, because then that sets them up to be afraid. And most children, when they come in, and if mom or dad has had talked positively about it and all those things, when I have to give them a shot, they don't even know because of the technique that I use. And I have a 14-year-old that I've treated for forever, and her mom will say, has Dr. Sledge ever given you a shot? And she says, no, she would never do that to me. And I've probably given her 8 or 9 over the course of her life. So,
wow, that's great. And moms and dads, you can fake it. It's okay. If you're scared, children pick up on your feelings in 3 seconds. You may think you're not letting them see it, but Dr. Catherine is so right. Start talking about it if you have a toddler, about how you're going to go meet the dentist and how they have the treasure chest or whatever it is, and how, the teeth are going to be so happy and look so pretty, and talk it up and keep your feelings out of it, because I know sometimes it's difficult, but they will pick up on it. So really great tips from Dr. Catherine Sledge. We're going to have another commercial break, and when we come back, we are going to talk some more to her. If you have any questions, you can still call us at 877-864-4869. Thank you for all the great questions so far. The music is coming, so please stay with us. We'll be right back.
We'll be right back with more Help My Baby Came Without Instructions. It's Baby and Toddler Instructions with Blythe Lipman on TogiNet. We'll be right back right after these.
It's words you never heard.
We've known for a long time that diamonds are precious or worth a lot of doodle-roomas. That means money. Did you ever wonder how a polished pebble becomes one of the most expensive things on Earth? 2 centuries ago, diamonds were worn only by royalty. But in 1870, miners discovered huge deposits of diamonds in South Africa. And soon after, the diamond market was flooded. That's when a man named Cecil Rhodes started buying up shares of the diamond mines. 18 years later, Rhodes controlled the entire South African supply of diamonds. He started his own newspaper and magazine articles with clever ad campaigns about cut, clarity, color, and carat. He also convinced women that they weren't truly engaged to be married without a diamond ring.
It's words you never heard.
I'm Carolyn Davidson, and you can have fun challenging your words you never heard vocabulary with my free app, Too Funny for Words.
It's the Fitness Minute with fitness expert Annette Hammond.
Runners are frequently plagued with injuries, aches, and pains. Much of these injuries can be traced to how they are landing on their feet when they run. When a runner lands on their heels, it sends forces up to 3 times their weight through their body. In the journal Medicine and Science in Sports and Exercise, it was recently reported that runners who land on the ball of their foot are 40% less likely to have repetitive stress injuries than those who touch down heel first. When a runner lands on their forefoot, the impact is barely measurable. Shape Magazine says to land on the outer ball of your foot, behind the second to last and pinky toes. After the front of the foot hits, let your heel naturally touch down, then push off with your toes again to begin the next step. I'm Annette Hammond. If you're a fan of Fitness Minute, like us on Facebook at Fitness Minute with Annette Hammond.
Welcome back to Baby and Toddler Instructions with Blythe Lipman on TogiNet, the hour for all moms with little ones to come for great advice, encouragement, and great ideas for all new parents. Now, back to the show with Blythe Lipman.
Well, welcome back. I cannot believe we are up to the last part of the show. It goes so quickly. And you know what? I am so excited that Dr. Catherine Sledge has been on the show today. We still have a little bit of time left to talk. And we were chatting during the break, and she wanted to share a little bit more about tongue tie because she's a true expert in this and has done research. And anyway, let's talk about what we were saying during the break, Dr. Catherine.
Sure. I just wanted to add that for any of you listening who feel like your child may have this issue or you think that they should be evaluated, make sure that the provider that you choose to evaluate your child is very well versed in this area and up to date with the most current research, because it is a newer development in the medical community as far as the ways that it's treated and addressed and evaluated. Not every pediatric dentist or dentist, not every pediatrician, not every neonatologist is going to be up to date with that research, because it's not really something that is taught extensively in medical school or dental school. So make sure when you call and are checking that out, who your child's going to see, that you're sure that that person is up to date in those areas. And the other thing that we were talking about over the break is as far as when it first shows up, a lot of times if a mother's breastfeeding, there are going to be symptoms in both mother and baby. So some of the symptoms would include in the infant colic and excessive gassiness, reflux, falling asleep at the breast very frequently, not able to sustain their latch well. And then for the mother, things like extremely painful breasts and nipples, likelihood of having mastitis or thrush, and a low milk supply. So any of those issues can kind of be indicators that tongue tie should at least be checked for.
Well, thank you for sharing that. And if you think your child has tongue tie, just, you know what, it can be taken care of, as Dr. Catherine says. There's so many things that we think about when we have a new baby. Try to relax. Just try to relax and enjoy it, because I'll tell you what, they grow up so fast. So fast. So on that note, what is your favorite parenting tip since you have children?
Probably, I don't remember where I read this, but I read it in a book somewhere that was just about being a mother and making a home for your children and your family. But to say something that is affirming and encouraging to your child each morning when they wake up and each night before they go to bed. And what I say to my little boys, I have 2 little boys, it's different for each of them, and they know I say the same thing every night. And I get right on their face and I kiss their little nose and I say, "You are my," and one of my little boys says, "You are my precious gift from God. I will not forget." And the other I say, "You are my," and he says, "Baby boy, and your precious gift from God." And so just saying something affirming to them that lets them know that they are loved and they're important and special to you I think is such a good way to begin and end the day, because it sends them out with that foundation of stability and security as they go into to conquer their little day. So
I love that. That's great, because you know what we do? We do our rituals. We read a book, we kiss them goodnight, but I love that the last thing they hear and the first thing they hear is that how much they're loved. What a wonderful way to start and end the day. I think everybody should do that. Okay, also, thank you for sharing that. That's a terrific tip. If my guests want to find you, where can they find you? And can they call you if they don't live in your state?
Yes, absolutely. And we, as far as tongue tie goes, there are lots of people who travel to be able to find a provider who is experienced and up to date on the research. So we gladly accept patients for that from other states or out of town. So please feel free to call. And even if you just need some advice, I'd be happy to help you with that. As far as contacting us, again, I'm Dr. Catherine Sledge, and my practice is just outside of Jackson, Mississippi, in Ridgeland, Mississippi. And our website is cartersledgedental.com. And my office telephone number is 601-607-7876.
Okay, and I will put all that on my website, mybestparentingadvice.com. So we still have a little time left. Let's talk a little more about dental health. Is there a specific kind of toothbrush you should get your child at different ages? Are they saying soft, hard, medium?
For sure, soft or medium. I'm not actually even sure why they still make hard toothbrushes, because the American Dental Association has said for years that hard toothbrushes can be destructive to tooth enamel, and I see the effects of that in my adult patients all the time now. Had a man in just yesterday the sides of his teeth were eroded away because as a child he had scrubbed very hard with a hard toothbrush. So for sure you want to stick to soft or medium toothbrush. For your infants, they make tiny little brushes, and they also have a little sort of rubbery finger brush that you can insert your finger in that has kind of soft little rubber projections off of it that you can use to stimulate and clean those gums. I really like those a lot.
I like those too, and it's really, there's nothing like bonding with your baby, and you know what? You can have this thing on your finger and sing to your baby while you're cleaning their gums, and it is really soft. So it must feel good. How about when they're teething?
When they're teething, oh gosh, that's a whole nother ballgame.
Yes.
There are lots of different things you could do. Absolutely, rubbing and stimulating the gums because they're itchy. They're just itchy, and obviously those little babies can't get their fingers in there you can't really scratch that area anyway. So if you can use one of those little rubber finger brushes, that's really helpful. Also, cold frozen fruit is something that I tell people sometimes to let a baby gnaw on. They even make little mesh teethers that you can put frozen fruit or something like that in. So those are good tools.
Because teething can be tough. I'm asking you this as a mom or maybe a dentist too. What do you think about like the Oragels as opposed to have you ever used any of the homeopathic remedies? What's your opinion on those?
I prefer to use, if I'm going to recommend, I try to recommend as many all natural things as possible. I try to, if I'm going to recommend an Oragel, I say Oragel Naturals, something like that, just because I'm of the belief that the human body is made to handle what it is thrown at it with development and all those things. But we do want to try to alleviate some of those issues. But I tend towards more of the homeopathic type remedies.
I didn't know Oragel did the naturals. And you know what? That's interesting because last week I was talking about the fact that Highlands, which is a company that makes teething tablets, they recalled the teething tablets again because they have something in there called belladonna, which is a narcotic type thing. And with the homeopathic remedies, it doesn't numb the gums. It helps all the symptoms, the crankiness, the itchiness, the sore gums, and So I talked about that last week with the teething tablets. I hope they do come out with some kind of a homeopathic tablet that doesn't have the belladonna in it, because I remember, years ago I used them for my kids, and I know many of the babies in my infant room's parents used them because they were tiny and they melted. And so it's good to know the Oragel does have a natural Oragel. And also, what about the toddlers that are getting their wisdom teeth? When do they come in?
What do you mean? You mean their
molars, excuse me.
Their molars. Okay. So usually around 24 months is when you'll kind of see an increase in fussiness, or at that point they may be able to communicate with you as to when, as to the pain or irritation that they might be feeling, or they might just get really cranky. But kind of the same thing. The Oragel Naturals is what I usually recommend if there's an issue there. And unfortunately, those molars have a bigger surface area than, say, a front tooth, an incisor. So it's a little, it's difficult as that's happening. But just the Oragel Naturals is really the best. And unfortunately, you kind of have to suffer through it a little bit.
And you'll know, what, also, I just want to add one thing quickly because we're almost at the end of the show. I found in my infant room, sometimes you'll have, my toddler room, sometimes you will have a biter. If you have a child that starts biting, and not every child bites, you know what? Take a look or check with your dentist and see if they aren't getting those teeth, because they hurt. We don't remember.
Exactly.
But it does hurt, and they can't say, my gum hurts. And then the frozen fruit, like you said, I love those teethers. They're wonderful, those mesh teethers. Anyway, we're at the end of the show, so I'm going to have to let you go.
Well, thank you so much. I have very much enjoyed being a part, and I just appreciate you very much.
Well, thank you, and I would love to have you back on again when we can talk about all the new things that come up, because we have so many questions about teeth, and we want to keep our little ones' teeth healthy. Great dental health for all of us. So thank you for being on the show, and you have a wonderful rest of your day.
You too. Thank you.
Take care. Bye-bye.
Bye.
Wow, that was really terrific. All the interesting things about tongue tie that I didn't know. I love my guest. I learned so much from my guest. It's just terrific. I am so honored to be able to have my show and talk to all these guests. Speaking of that, next week my guest will be Sarah Blanchard. We are going to talk about the Flex Mom. And she's the author of The Flex Mom, The Secrets of Happy Stay-at-Home Moms, and we are going to talk all about that. The show was pre-recorded, so if you need to get me during the show next week, you can always go to my website, mybestparentingadvice.com, or go to toginet.com. And as always, I like to leave you with a little humor, and I just saw the greatest quote from Milton Berle. He said, laughing is an instant vacation, and isn't that the truth? So today, here it is. What I say to my son, please get dressed. His interpretation, I think I'll stand around naked with one sock on. Boy, I can remember that. I used to think I was a patient person until my toddler got out of bed for the 11th time to ask me why ducks don't have arms. And finally, I think they should make Lunchables for moms. Of course, they should have wine, cheese, and chocolate. Boy, wouldn't that be great? Anyway, St. Patrick's Day is coming up this weekend. Make sure you all stay safe and enjoy if you're celebrating. Thanks so much for tuning in. I want you to all have a great rest of your week. Have fun. Take a little time each day with your little one, and I will see you next time. Bye-bye.